Awesome, thank you for that. So I am joining here from Saskatoon, so Treaty 6 territory, homeland of Métis. Specifically, IDAC, I'm here in IDAC, so this is IDAC office behind me here. And our office is actually located on the Muskeg Lake Cree Nation here in Saskatoon on the urban reserve. So specifically, they had asked us when we were opening and we took possession of IDAC to provide the land acknowledgement specifically for IDAC. And so I'm still adapting to it. I'm just actually literally going to quote it because I want to respect. So I'd like to begin by acknowledging that the land on which we are discussing is Treaty 6 territory, the traditional territory of Cree peoples, and specifically the Muskeg Lake Cree Nation, whose urban reserve, Asamakina Iski, the Veterans Land, is the location of this development. And when we had come here to and started our and opened our IDAC location, we had reached out to them to ask them if there was specifically a land acknowledgement that they wished for us to use and one that was most appropriate for the area. And part of my reconciliation journey, because I am from Manitoba, my family is back in Manitoba, and I'm a member of Sagkeeng First Nation, is coming here as a visitor to the territory. I had made a commitment and I'm still on my journey, and I'm sure I'll be on my journey for the whole time I'm here, is to get to know the land, learn how to, as a matter of fact, I was within the year that I was here, my first year I was here, I started taking Cree. In Manitoba, I was learning Ojibwe. So the I guess combining the two sometimes happens with me when I'm trying to figure out my words. And so that is part of my reconciliation journey. I know with reconciliation, we kind of come from an area where I think we all have some sort of role to participate. And for me, that means something. And for others, it means something else. But I guess what I would like to do, if that's possible, is just share my screen. Is that possible?
Yep, for sure. I will make sure you have sharing privileges. I think you should already.
Great. Is that full screen?
Looks good for me.
Okay. So the very first thing that I would like to do is introduce myself. And I think this is part of that location that we talk about. So in the introduction, I introduce myself and acknowledge my Indigenous ancestry. Specifically, I guess it would be because I am a member of Sagkeeng First Nation. But when I'm getting to a little bit more in my comfort zone and a little bit more of my space, I guess it would be public speaking would be my deficient areas. And part of that is just trying to get through my presentation. But what I've been doing lately is pausing and kind of letting everybody get to know me, because I think with self-identity, self-Indigenous identity is I'd like to introduce myself so that everybody knows exactly where I'm coming from. So part of my family, my siblings, my mom and dad are located on the bottom of the screen in the bottom middle. And as we probably all know, it's very difficult to get family together when we're coming together. And so there still is this one sister missing out of that picture. But that is my family. I do have my 3 brothers and my 4 sisters. So there's 5 girls, 3 boys. But with that being said, we also have a sister that we haven't been able to locate that was adopted out in the late 60s. And we've done everything we can to locate her, and we've reached out to every possible, I guess it would be government organization looking for that sister, and we've never been able to find her. But those are my siblings. My dad's family is a part of Peguis, which was previously known as St. Peter's before they were relocated to Peguis. But with that relocation, my family actually didn't go out to Peguis. Some of the family members had stayed registered, and my dad had moved to Sagkeeng First Nation. That's how we ended up where we are. My mom's family, on the other hand, her family originated out in Manigotagan area, which is also known as Bad Throat, which is a Métis settlement. And so when I was growing up, it wasn't until 1985 that we learned that we were actually eligible for treaty status, because my grandfather had lost his status for whatever reason, and we anticipated it was because he had served in the army. But growing up to that point, we identified as Métis. And so I have this combined ancestry with very rich culture that seems to come together. And this is what I think has made me resilient in coming through and negotiating the systems. Now in the lower left, I guess in the lower right side of the screen, those are my kids. Now, obviously they're older and it is very difficult to get them together now that they're adults, but that was the last photo, the professional photo that I had from when they were little. But that is me in a nutshell. I kind of originate from all over Manitoba. I'm related to pretty much wherever I go in Manitoba, I find relations and relatives and cousins and third cousins. So that is me. And then very quickly, I just wanted to share my journey of trying to figure out who I am and where I come from. And you might notice over on the middle section there is that that was my mother's paternal side, which she was not very familiar with the biological paternal side. We were not able to locate who her biological father was, but her the only father that she did know, we do have in that space there. And so that was my grandfather, Simard. And he was from the Manigotagan area as well. So now we're going to talk a little bit about oral health. Oral health is very interesting because in Canada, it is really not, it is considered a part of the healthcare system, but technically it doesn't, a lot of the financial portions are not covered in the healthcare like it is for medicine. And it becomes, I think it becomes a little bit more, I guess it would be a business oriented, I guess it would be profession. And so for me, coming back and putting the health back in, I think that part's very important when we're talking about oral health and in general. And so this is why I wanted to share this slide with everybody, is even though we talk about oral health, we always think about the teeth. We can't just think about the teeth. We always have to think holistically, and that, you know, obviously the teeth are in the body and it does have its impact, so we can't think of it in isolation. So the part that I wanted to pull out of here is that oral health is much more than healthy teeth and a good looking smile. The mouth is a mirror to the body and often reflecting signs of other diseases. And so if you're thinking about, I guess it would be the overall health of a person, when you're looking into the mouth, it's actually a gateway into looking into how healthy we are as well. So if we tend to have dental decay or gum disease, which includes gingivitis, or any kind of issues happening in the mouth, it does ultimately impact, it reflects our health, but it also impacts our health as well. And we'll get into that just a little bit more without going into too much detail, because I don't want to bore everybody either. The example that it gives is that oral lesions may be the first signs of HIV infections, and changes in tooth appearance can indicate serious eating disorders. But there's also other things that we look for when we're doing oral examination checks. And part of that would be, you know, are the teeth mobile? Because if that indicates that we have gum disease, or what else also is known as periodontal disease, that can also tell us that our body might not be healthy as well. And so it kind of cautions us and gives us the heads up that we should be looking a little bit closer into the overall health of a person that we are examining. Now, I do have a picture on the side of this slide as well that talks a little bit about edentualism, which that is basically if we've lost all of our teeth and we have no teeth. So, and sometimes that results from gum disease, but sometimes it can also result from dental disease as well. And of course, aesthetics or even trauma where we lose our teeth. When we're doing an examination, we're also looking for oral cancer, signs of oral cancer. And then of course, when we're looking in the mouth, I mean, I'll get a little bit more into detail in the further slides as well, is that we're also taking into consideration cardiovascular disease. And I know, you know, and this part is always, it always is so interesting for me, is because I became a dentist so many years ago. And even at that point, when I had graduated coming out of dental school, we didn't really think of it way back then as, you know, as an indicator of overall health either. And the impact over the years with the research that's been coming out is how the impact the mouth can have. And then we'll even talk a little bit about diabetes and how it's like a two-way street. It's a give and take between diabetes and how it contributes to poor outcomes with diabetes as well. Then we have, it would be research that also points to the respiratory diseases that are associated with dental, including periodontal disease. And then of course, preterm babies, which, you know, that one, when I started doing my research was quite interesting to learn about, is how gum disease is associated with the higher risk of preterm and low birth weight babies. But let's start right from the beginning. So we want to know what causes cavities and what causes gum disease. And the start, and one of the good starts when we're looking at a localized cause, which is something that is right at the teeth, the very first thing that we need to look at is tartar. So this is also known as plaque. So this is a deposit that's there, and it eventually, it first starts off as kind of like a soft, mushy white stuff that kind of sits at the teeth. And if that is able to sit there for any period of time, it actually is, it's almost like a sponge for bacteria that comes in. It actually comes in and it sticks to the plaque. And so those together, it almost feeds it basically feeds the bacteria. And once the bacteria is able to work on that plaque and eat that plaque, and it's kind of secreting acids that break down the teeth. And so this is kind of where that comes from. But this is basically tartar over on the left. So when that plaque has been sitting there for some period of time, and is allowed to sit there for over a period of time, that plaque actually turns into something hard. And I'm sure many of us have been to the dentist where those hard deposits on the teeth, now these are not easy to get off. Typically, they have to be removed by a dental therapist, a dental hygienist, or a dentist that's doing an examination. And there's reasons for removing that hard deposit. And so those have to be scraped off. And when you're getting your teeth cleaned, you can hear like little clicks and little parts coming off. Well, those are the deposits that we're talking about here. And so if those deposits are allowed to sit on the teeth, what happens is it continues to grow. And if it continues to grow, it can actually result in pushing the gums away and moving downward toward the root. And that can result in periodontal disease, which we'll actually get to some pictures to look at that just a little bit closer. But the biggest part of this one is when the plaque first develops, it does kind of act like that sponge for bacteria to come, and this is what causes cavities and gum disease. Now, we do have a couple definitions here, and I went to the kind of like the big guys. And so I'm going to provide a couple, I guess it would be indications and definitions from various, I guess it would be the important guys that we consider in oral health flows that we tend to go to for references and information, and not just Canada, well, not just Saskatchewan, not just Canada, but for right around the world. And according to the World Health Organization, I'm just going to get out of this full screen if I can, because I can't read all of it. So basically, it's just dental caries results from the plaque that forms on the tooth. It converts, basically, like I said, it eats the sugars and the debris from the plaque that's sitting on the teeth, and then it secretes an acid that breaks down the teeth. And so this is the definition for dental caries that they basically give. But we will talk a little bit further. So this is the localized definition for dental caries. And so this is right at the cause, and almost like when we were going through dental school, there was like what we called the biomedical model, where basically it's on the teeth, and this is what causes cavities. But we're still not considering everything outside the mouth that also contributes to cavities. So this is just looking right at the teeth. And then we also have periodontal or gum disease. And so there's a whole range of gum disease that we need to consider as well. So gum disease actually starts off as gingivitis. And so gingivitis is reversible, which means that it starts off with kind of a little red at the gums. And so we have a little inflammation of the gums. So if we brush our teeth, we might notice a little bit of bleeding. around the gums. But this is the early stages of periodontal disease or gum disease. And if we're able to get in there and brush and floss in about 7 to 10 days, you would notice that the gums toughen up, the gums stop bleeding, and then there's no damage left behind. We've kind of been able to deal with it. It's just at the gum line and it's just the gums. However, if it progresses and is enabled to progress, then we see the progression of gum disease that starts off from kind of like a mild case of periodontal disease, where when you're getting your checkup, you'll notice when we're measuring around that tooth, we're getting little pockets around the teeth. You do not see the pockets that are actually changing with the bone level with gingivitis, but we're starting to see that with early gum disease. We may notice a little bit of probing depth, so the measurement of the pocket around the gums with gingivitis might be starting to increase, but that's only because the gums are a little bit inflamed and therefore they're probably a little bit poofy. There is an exception to that rule though. So if we are smokers, unfortunately, that indication that we have to show us that gum disease is happening, that's kind of taken away because the gums tend not to bleed because we are smokers, and that is, I guess we have a little bit less bleeding at the gum line that happens. But if that's allowed to progress, then we move on to more severe form of periodontal disease. And this is where we start losing the bone support. The gums become very inflamed. I'm going to show you a picture of that right away of what that looks like. But first, I want to give you the definition of oral health. And so this part is important. I had already talked about how we can't think of, especially as a pediatric dentist and a dentist, is we can't think of teeth all by themselves. So oral health is multifaceted. So when we consider oral health, it's the overall oral health. So it includes our ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of motions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. So that includes the whole head, face, and oral cavity. And so oral health means the health of the mouth. No matter what your age, oral health is vital to general health and well-being. So we're stepping outside our comfort zone in the little specific area that we tend to really focus when we're in the dental clinic, is that we do have to take into consideration the overall health of an individual, which, as we know, is, I guess it would be a common perspective that we have when it comes to Indigenous health, is we do tend to think outside. I guess it would be Western thinking of just the biological part of our health. And so we're going to move on just a little bit about oral health. And so the first one we're going to talk about a little bit is dental caries. And so I threw in a picture there just to show us. So at the beginning of all of this, the one thing that's not included in that picture is that we do have teeth that do not have cavities. Here, I just wanted to demonstrate that how cavities start is they actually start off small. And if you look very closely on the left side of the screen, is that there are different layers to a tooth that is present. And in that layer of the tooth, you have the enamel on the outside, the dentin inside. And so you'll see on the commercials on TV, when we get the tooth sensitivity, usually that's because the layer underneath the enamel is exposed. And those ones is where we have, I guess, the feeling coming in that would give us the sensitivity. And then underneath that dentin layer, we have the pulp. And then, of course, we have to remember that we have the surface of the root as well. And the root surface we typically don't see. And if we do see the root surface, that means we do have gum disease or periodontal disease. And so when you're looking at the tooth structure, you'll see that the tooth is actually supported by the bone that it's sitting in. There's the periodontal ligaments that it's sitting in. And so that's just like a little hammock that it sits in that enables it to function. And you'll notice that the little nerve bundles underneath is also the blood supply and our nutrient supply. So it's kind of almost like feeding the tooth. But also in that demonstration, you'll see that we have cavities that can happen on all surfaces of the teeth. So on a tooth, there are typically, you would think about 5 surfaces. So you have the biting surfaces and all the surfaces around the tooth. So if you're ever in a dental clinic and they're checking your teeth and they're calling out surfaces, this is what they're counting out. And each tooth has an identifying number. So you'll hear them calling out numbers and surfaces when they're checking teeth. Then you'll also hear numbers being called out in a normal checkup, because what they're doing is they're checking for pockets, and anything typically over 2 millimeters around the if they're looking for pockets around the tooth, the numbers that they're calling out is just indicating how deep those pockets are. So anything over 2 is, we're kind of caution, we're kind of watching. And then of course, as we get a little bit deeper, then we're starting to think a little bit more about periodontal disease that's happening. And so the couple of the signs for dental caries. So if you have cavities in your mouth, some of the things that you may experience, or some of the things that you may feel when you have cavities, is that you might notice that food gets trapped between your teeth quite frequently. And I'll show you a picture of a cavity where we have what we call kissing cavities. So if these are 2 teeth that are right up against each other, you'll notice right in between, there might be a hole starting here. So typically, especially if we're not flossing, we do see cavities happening in between the teeth. And so in these little holes that happen in between the teeth, you'll notice that food easily gets trapped in there. You also notice some discomfort or pain in or around your mouth. And so depending on the size of the cavity, as you can see with that demonstration of the tooth, smaller cavities might be start off a little bit sensitive, not typically painful. You won't get toothaches that's happening on them, but you will have sensitivity, especially to temperature changes and things like sugars and stuff along that line. You may also notice difficulty biting down on certain foods, sensitivity to hot, cold, or even sweet foods. And another thing you might notice is bad breath. Now, this is also referred to as halitosis. And that one's a little bit complex. So we do have like a list of things that we do consider when somebody comes in with bad breath. It could be that we have deposits that are happening and some foods getting stuck underneath there. It could be cavities. But there are also systemic issues and medical issues that we also have to take into consideration as well. So there could be GERD, so gastroesophageal reflux, things along that line that could be happening as well. Or it could be something as simple as having tonsil stones that are happening in our tonsil bed, because those can sometimes result in bad breath as well. Sometimes we can have an infection of the throat. But one of the very first things that we do look for as well is how healthy are the gums, and do we have any cavities? You might notice white, then dark spots on your teeth. And I'm going to show you a picture of early cavities that we call incipient, in addition to some of the actual cavities on teeth. But the demonstration there also shows, on the right part of the screen, shows the different cavities that are happening on the teeth. And at that, for each of those stages, it'll show, you know, as long as it's into the dentin, we might have a little bit of discomfort, but typically they're not painful. But once we reach into that dentin layer, so that's the layer underneath the enamel, sometimes it can be quite painful, definitely sensitive. But then of course, when we get into the pulp, which is the layer underneath the dentin, and that's the nerve of the tooth, then that stage can be very painful. It can be very uncomfortable, because not only is it right against the nerve, but as you can see on that demonstration, we can also develop infections that happen. And then those infections typically on a permanent tooth happen in the bone at the tip of the roots. With children's teeth, it's a little bit different. If we have a cavity happening on a baby tooth, if a root is kind of like this over here, which is typically, baby teeth tend to be kind of spread out like this, infections on baby teeth tend to happen in between those roots. But regardless, typically infections we'll see happening over on the cheek side or the lip side, but sometimes they can also cause infections that result in swelling of the lower jaw, up in the eye. Those ones are actually pretty significant and very important to have treated as soon as possible if that happens. And so what can you do if you have cavities? So you can go visit the dentist regularly so that we can prevent them. We do the x-rays in between the teeth so that we can check to see, because if it's happening in between the teeth, it's very well hidden until they actually turn into true cavities, which are the holes in the teeth. That's the only time we get to see them happening in between the teeth. So the x-rays are actually pretty important for detecting the cavities when it's earlier. You can avoid diets high in sugar. So eating a balanced diet, brush your teeth for 2 minutes twice a day with a fluoride toothpaste. In an ideal world, we'll definitely want to brush our teeth every time we eat, just to make sure we're getting clean. And then of course the flossing as well. what is the impact of dental caries? So when we're thinking about cavities, I think this part is very important as well, because being in the oral health world, we tend to kind of we fall by the wayside and, it's just teeth. But the thing is, it can actually have a really negative impact on a person overall. So for an example is at night, sometimes we can have a cavity that keeps us up all night, and then we miss work the next day, or we miss school the next day, or we can't think properly because we have such a toothache. It does have impact on us to the point where sometimes you can't eat properly. And if we can't eat properly, then we're not getting the nutrients in our body. There are a lot of, I guess, bad things that can happen if we have cavities, whether they're small or large. And so here's the picture I said I would show you. So on the left side, you'll notice that there's a really strange shape in the center of those teeth. Well, those are actually braces were removed from these teeth. And so were the brackets. So those little parts that hold on the braces were cemented onto the teeth. It protected the teeth, but the parts that weren't brushed turned into cavities. And so we have the white spot lesions where the arrows are pointing, and that means that there's early cavities that are not quite holes yet, or cavities. But if you look over where it says cavities, you can see the actual holes in the teeth. And so those are referred to as cavities. But on the bottom portion, you can see the gingival inflammation happening there because the plaque has been able to sit there. Where those white spot lesions are, that's exactly where we see the plaque that's sitting there. And that's why it's important to be brushing off that plaque. And then the right picture is just showing what I called the kissing cavity. So the cavity is happening in between the teeth and where the food gets stuck. This is typically where we see cavities in children when we don't see the spacing that we are always looking for. If children have spacing in between the teeth, which is what we're always hoping for, it reduces the chance for cavities. But if the baby teeth are touching so close together, we have a high chance of getting cavities in between the teeth. And then this seems all very complicated, but the one thing I wanted to show you is those little 3 bubbles on the bottom is kind of like that biomedical model that I talked about. So this is an older version of our biomedical model, but I wanted to give you an idea. So we have the localized in the oral health, but if you take into consideration a person's genetic and biological factors, so our genes and what we're born into, our social environment, so our home environment, our physical environment, and then our health behavior. So in the dental clinic, what we tend to always fall back on is the dental care. So are you coming into the clinic and are we able to do your dentistry? So are we able to give you cleanings? And then health behaviors, are you brushing and you flossing? But that's only a part of the equation. What we need to also remember is that where we live and what is available to us, which would include oral hygiene products, a good diet, water, healthy living space, all of that stuff plays into consideration when we're talking about cavities and periodontal disease or gum disease. Now we'll very quickly talk about periodontal or gum disease. So I had already talked for the most part about it, but the cause for gum disease is if that plaque is able to sit on there, or we have some systemic disease that increases that probability or the chances of us getting it. So we have inflammation of the gums, and remember, it begins as gingivitis, and if it is enabled to progress, this is where it results into the periodontal disease. And in very serious cases, it results in us losing our teeth because the teeth actually become loose and are no longer supported in that bone, the gums and the bone that are holding it in place. Now, the signs of periodontal disease are the red and swollen gums that bleed easily, especially when you brush or clean between your teeth. Remember, sometimes we don't see this if a person is a smoker. And then we have gums that have pulled away from the teeth. So this is called recession, and basically they're shrinking away. We have a constant bad breath. We have pus between your teeth and the gums. So it's suppurative, which means that it's kind of oozing the pus, and that's just an inflammatory process. Teeth that are loose are moving away from one another, changes in the way your teeth fit together when you bite, because sometimes you'll notice that such movement is that sometimes even if you push on your tooth, you can even sometimes move your teeth as well. And then changes in the way your partial dentures fit. So if you have a partial denture that you usually hold on to teeth You might notice that there's a change and it'll no longer fit or it'll no longer be snug in place. And then, so this is basically the diagram I had for periodontitis and advanced periodontitis. So these are gum disease, and you'll notice that there's the pockets. We had talked about those pockets. And then of course we measure from the crown, which is the part of the tooth that we can usually see in a typical presentation of a tooth. So it's only the white portion of the tooth. If we go down the root, that actually is part of our probing depth, we call it, and that's basically part of the pocket. And so if we start seeing our gums, then we know that we have gum disease. And then I just wanted to show you, I'm not going to go into this in great detail, but over on the left side, you'll see that it starts off as just gingivitis. So we have the normal gums. You can see that it's pink and healthy. There's no red around the gums. But then you have gingivitis. You start noticing the little red rims around the gums. And then you have initial to moderate periodontitis. So now you're starting to see even the gaps in between the teeth, whereas over in the healthy gums, our dental papilla, it's called. So those are our gums in between the teeth are closing the space. But now we're starting to see those spaces open. But then you'll see in severe periodontitis, you can actually see the roots on those teeth. And then of course, those big triangles of spaces. So that's a big indication of having gum disease. Now, the one thing I do have a big lecture on diabetes that I had given previously, and it was quite an endeavor, is the two-way relationship between diabetes and gum disease. And there was, this may be something that I may want to provide in the future for if anybody is interested in diabetes, but there is a two-way relationship between the two. So if we have diabetes, it increases our chance of getting periodontitis or gum disease. And then if we have periodontitis when we have diabetes, then it actually results in an increase with blood sugar levels because of typically our diet that we are able to consume. So if you have gum disease, what can you do? You can visit the dentist regularly because it is a disease process. So it is, if somebody is paying attention, when your dental providers is paying attention, they will let you know if they're starting to see changes. You can prevent disease by managing risk factors. So you can avoid tobacco use and excessive alcohol consumption and eat a well-balanced, low-sugar diet. Adopt a good oral care routine. So I know coming back to the personal behaviors and the behaviors for brushing and flossing. And then of course, the twice a day with the fluoride toothpaste is also important. And what is the impact of periodontal disease? And so periodontal disease is among humanity's most common diseases. It affects up to 50% of the global population. And with severe gum, so remember, this is the most advanced. So when the teeth are very loose, the roots are exposed, it can result in tooth loss. And this affects 10% of the global population, which results in edentualism. And so that's when all the teeth are removed and then we coming up with the having the full dentures. And then again, to mention with the two-way relationship with diabetes in general, people with diabetes have an increased risk of developing periodontal disease, and treatment of periodontal disease often improves the blood glucose levels. And that part is very important to remember when we do have diabetes, is having those regular checkups. And I'd probably recommend more frequent visits with the dentist when we have diabetes. And I won't go through this here, but you'll also notice that the World Health Organization gives additional and a little bit different risk factors associated with gum disease. And they included smoking, diabetes, poor oral hygiene, stress, heredity, which is our genes that that have been passed down to us from our parents, crooked teeth, underlying immunodeficiencies, fillings that have become defective. And so this is why it's important to visit the dentist frequently, as if these can be preventable, actually, like for example, the fillings, or even if the plaque is able to sit on the teeth, if we can get in there and remove those sooner rather than later, it decreases the chance of it reaching that advanced stage that we saw pictures of. And then of course, bridges that no longer fit properly. So that would be, it would include the crowns, taking medications that cause dry mouth, and female hormonal changes such as pregnancy. And then the gum disease risk factors. So this was actually from the American Academy of Periodontology, and they included age, smoking, tobacco use, genetic stress, which was not mentioned previously, medication, clenching or grinding your teeth, which if the dentist noticed that your teeth are starting to wear flat, they can prescribe a mouth guard, or other systemic disease or poor nutrition or obesity. And here, just very quickly, I wanted to share with you, I had talked previously about dental being confined to just the mouth. We can't be just confined to the mouth, because we see in research that is showing that there is a relationship and association with diabetes, heart disease, respiratory disease, cancer, and Alzheimer's disease as well. So going for your regular checkups and having your cleanings and brushing and flossing, having a good diet and things along that line are actually pretty important. And then this one just shows you very quickly, when we have our regular checkups, we're looking at the teeth, and we should be looking at more than just the teeth and gums, actually tongues and lips, because there's also the salivary glands, hard and soft palate, and everything else that we do take a peek at, including our lymph nodes and our glands underneath. Our jaw joint is another one that we take a peek at. And then very quickly, I had already mentioned the associations and relationships I just wanted to include that to show you that we do take into consideration more than just the mouth when we're considering oral health, because it is a part of our body, and it is a gateway for us to be able to feed our body. And so how can we deal with everything that I've just given you? It sounds very dismal, but it is coming back again just to the health behaviors, ways that we can keep our mouth healthy. And so you can see your dentist regularly, so regular checks and cleans, and depending on what they find, they will, the dentist, the hygienist, the dental therapist, they will base what they find in possible risk factors. I guess it would be dental history as well. They will recommend a recall regimen, so how often you're going to be coming back and for what. You can choose a variety of healthy foods and drinks each day, and there, make water your drink of choice. So we want to reduce the amount of sugars, and of course, healthy snacks like cheeses, nuts, vegetables, and non-acidic fruits are very important as well. You want to get your mouth checked regularly, look for signs of gum disease, and of course, we always want to look for signs of oral cancer. And then, of course, I've placed on there as well what we're looking for when we're coming in and taking our peeks. You want to limit alcohol and avoid smoking, smokeless tobacco, and vaping. And then brushing and flossing is very important, and very quickly how to brush. So use a soft brush with rounded bristles. You're going to choose a size and shape that allow you to reach all the way to the back teeth, even for children, especially for children, because children don't necessarily match with their age for their body size. Is you want to pick a toothbrush that they're going to be able to fit back. And my kind of rule of thumb is, is it going to get in the back of the teeth? And if it's not going to, switch to a smaller toothbrush so you're getting all the way back there. You want to replace your toothbrush every 3 months. So when you're brushing your teeth, remember, part of gum disease is making sure that your gums are healthy. So what you want to do is preserve your gums. So you're going to brush at a 45-degree angle to your teeth. You're going to put the bristles, so the toothbrush, right against there, and you're going to use gentle circles. You don't want to scrub really hard, because that's what causes recession. So you're just going to go in gentle circles. I always say massage your gums. That's more than adequate, because you're not trying to get the bristles be in between the teeth, because that's what you're going to do when you're flossing. So years of brushing too hard can make your gums recede. And then, of course, you're going to clean every surface of your tooth. So you remember, I told you there are 5 surfaces of the tooth that you need to get. And then, of course, you want to brush for at least 2 or 3 minutes. And that kind of gives us our timing to be able to make sure that we got all of our teeth. And of course, if we have wisdom teeth back there, we definitely will be taking a little extra time to get back there. And then in the end, don't forget to brush your tongue, because that is one of the causes for halitosis, or bad breath as well. And it is also another sponge for bacteria to get stuck. So if you're not brushing your tongue, you're leaving bacteria behind as well. And then how to floss. So basically, you're going to find a way that's most comfortable for you. And here's a demonstration for one way. Flossers are also available. That makes it much easier. And then when you get in between the teeth, you're going to go up and down a couple times. Now, it's very important not to snap your floss down, because you can actually cause trauma to your gums, and you don't want to do that. So all you're doing is massaging. You're creating a C around the gum or around the tooth, and you're going up and down. But when you go in between the teeth, you have to remember there's 2 teeth to clean. So one in the front and one behind. And very quickly with children, this is for children, how to brush and how to floss. Basically the same for flossing. I would definitely recommend starting children early, even if they have spacing in between their teeth, because it actually sets children up for behaviors into adulthood. So the earlier you start, the healthier they're going to be when they get older. And research shows that children that have cavities when they're young tend to have cavities when they're older. So you definitely want to get children started early as well. So with the children, you hold the toothbrush at a 45-degree angle. And then, of course, you do the gentle circles. For the front teeth, you use the toe or the front part of the toothbrush. And with children, you definitely want to be gentle, because if you're not gentle, they're not going to let you back in there. And with toothbrushes, you definitely want to buy a new toothbrush or replace your toothbrush every 3 to 4 months. If you notice your bristles are getting really worn, it's probably because you're brushing too hard. So remember, gentle is all you need to do. All you're doing is removing that plaque. And if you develop those hard deposits, the only way to get those hard deposits off is go to the dentist, hygienist, dental therapist, and they actually scrape those off for you, and then you get a brand new start. Now with toothpaste, I followed with the Canadian Dental Association on this one. And so for children under the age of 3, they should have their teeth brushed by an adult. Use a fluoridated toothpaste in this age group is determined by the level of the risk. So those with a higher chance of getting cavities, then definitely want to be implementing the fluoridated toothpaste. Parents should consult a health professional to determine whether the child up to 3 years of age is at risk for developing tooth decay. And a practitioner in Manitoba has actually developed, Dr. Bob Schroth has developed a risk factor that's used not only in dentistry, but also in medicine as well, that we can be using for our risk assessment. And then, of course, the use of fluoridated toothpaste in a small amount has been determined to achieve a balance between the benefits of fluoride and the risk of developing fluorosis. I know that there is a big conversation about fluoride in water and fluoride use with toothpastes. And all I recommend with that one is making sure that you have your research done before you make that decision. And then consulting with a dental provider, a professional in that aspect. And many of what I guess practices, for example, with water fluoridation, it's based on information that's gathered right across the world for safety of fluoride use. And of course, we have our professionals and specialists in dental public health that have done significant amount of research on making sure that that is safe to implement into. But with respect to the children between the 3 and 6 years of age, you should remember my rule of thumb is if a child can't actually write, not print, but write their name, they do not have the dexterity to be brushing their own teeth, which means that parents should be getting in there and helping their children. And usually that's usually up to around the age of 8. If you can be helping your child, that will help significantly reduce the chance of them getting cavities. And that's it. That's what I have for you guys today.
Awesome. Thank you so much. That was super informative. Do we have any questions right off the start here? Is there any on Facebook, Katie?
Yeah, I just sent you one in the chat. We just have one so far, but if anyone else has any questions, you can put them in the chat on Facebook right now and we can forward those for you. I actually had a few questions written down as well, and I think they were all answered during the presentation. It was very informative.
So the one question from Facebook said, how close are we to free dental care in Canada? So I don't know if that means we as in Métis citizens or Canadians in general.
So for Canadians in general, we have the federal dental plan that is rolling out. So at this point, it includes that for those aged 12 and under. And there is a transition coming through where it will be for all of those, but it is actually, I guess it would be determined by somebody's income. And there is I guess it would be boxes to check for there are boxes to check in for eligibility, and it is based on income, unfortunately. So you have to be able to also have filed your income tax, and there's a little I guess it would be requirements for shared custody and things along that line as well. I guess it would be whether or not you have access to other benefits, because if you have access to other benefits, then you're not eligible. But I guess that's all based also on political access and whether or not this is going to continue through. I'm hoping that it will for sure. But right now that that access is only available to those 12 and under at this time, and only a certain amount of money. So unfortunately, in private practice, we're seeing that that is not enough at this point for those to receive all the treatment that they need. I think it's kind of like extending an olive branch where it's basically just helping out so that we can get that started at least. So the first year is ending June 30th for the applications for those 12 and under. And then after June 30th, I believe, the second year is starting. So, you know, I think we're moving in a good direction, but we have to wait and see if this is going to continue. I'm hoping it's going to continue, and I hope it's going to include all the age groups as well.
Awesome. I will plug our program too while we're talking about it, because you're right, it isn't enough to cover the costs. And our travel program, at least we try to reimburse for the fuel and meals. And so at least it helps with a little bit of offset that travel if you're having to go from your community for those appointments. So we do have that. But yeah, nowhere near close to totally free yet, I don't think. Katie, is there anything else from Facebook?
No, nothing on Facebook so far. Actually, I did have one question myself. I feel like there's so many new products. I think a lot of them are a little bit more expensive now, like electric toothbrushes and the water picks, and some of them are a bit cheaper though, like the tongue scrapers and all that stuff. I was wondering, do those actually clean a lot better than just a plain old toothbrush and floss?
So for me, it's I would say whatever works best for you. If a manual toothbrush, if it's just a regular old toothbrush is working for you and you're able to get in all the areas, it is more than adequate as long as you're using the other products as well. So a toothpaste, and I always recommend a fluoridated toothpaste as long as you're able to spit it out. That is another thing that wasn't mentioned in the little tutorials that I gave as well. Is one of the things that I do, especially for somebody who's high caries risk, is once you brush your teeth, I try to say don't rinse afterwards. So once you brush, spit out as much as you can and leave it, especially if you're doing it before bed, because then it's going to sit there and help protect your teeth longer. But if we do have disabilities or issues getting back there, and for children, this might actually be a good idea, as well as if you do have access to an electric toothbrush, and it is actually a little bit more a little bit easier for those to use, then I would say definitely use what is the most effective for you. And then with respect to the flossers, so we do have regular floss that is very difficult for children because they're not able to articulate their fingers. So getting in between the teeth is probably not possible, but we do have little floss holders that we do have available, even at just the regular drugstore. And those will actually get in between the teeth much easier than trying to get the floss, and especially with the smaller mouths, parents trying to get their fingers in there is very difficult. So those little flossers are a godsend when it comes to trying to floss. Rinses can sometimes help, especially if they're fluoridated, because that's a protective factor against cavities. So if we're able to rinse with that a little extra fluoride, that is definitely helpful, especially for the elderly or for those that have systemic or for those taking medications that reduces the saliva we have as well. So having that extra protective factor is actually very important, because once we have reduced saliva, then it increases our chance of getting cavities. But that was a very long answer to your question. Is you could probably, as long as it's adequate with your regular toothbrush, toothpaste, and floss, that's more than enough, as long as you're able to use those sufficiently.
I have a question too. My dentist always offers fluoride at the end, and I never take it because my insurance doesn't cover it, and I feel like I'm probably fine with my toothpaste and my mouth rinse and stuff like that. Would you agree, or should I opt for that extra protection?
So again, the fluoride that we place on teeth, a lot of times we base it on, I guess it would be our caries experience. And I talked about the caries risk factors. So in order for us to, when we're considering with this risk assessment that we do, so we have the risk factors and then we have protective factors. So if a person is brushing and flossing, has good diet, and has a good history with no cavities, then really if they're doing all the right things already, then you already have your protective factors. So if you don't have a high history of caries or cavities, then you're probably doing okay. But if we typically recommend the fluoride applications, especially if we had a cleaning done, because what happens is when we're working on the outside surface of the tooth, that's the fluoride rich area. So all we're trying to do is get the fluoride back to help get it in there. But with that being said, we have fluoride in our saliva anyway. It's naturally in our body. So in our saliva, it does go back automatically.
Okay, thank you.
You're welcome.
Is anything else popped up for us, Katie?
Nope.
Alrighty, well, I will do our outro, and then if anything pops up, let me know. Thanks for the question from Joseph on Facebook. Our next talk is going to be on July 13th at 7 p.m. again, and it's with members of Students for Harm Reduction and Informed Policy, which is a student group from USask College of Medicine. They'll be talking about harm reduction, including naloxone and drug testing. So that one's going to be really interesting. Mark your calendars for that on July 13th, and look for details on our socials. As always, we'd love to hear some suggestions for future Tea and Talk speakers or topics that you would like to learn about. So reach out if you have an idea. Thank you, Marcy. I hope you all have a good night. Thank you, Dr. McKinstry, for speaking with us and being here and just sharing your time and knowledge. We really appreciate it.
It's my pleasure.
Yeah, I hope everyone has a good night. Thank you so much. Mercy, take care.
Okay. We are off Facebook now.
Awesome.
Awesome. That's pretty good. I think I tried to go as quickly as I could to get as much information in.
Yeah, that was, people on Facebook were saying that was very informative, and yeah, I'm so excited. I've been wanting to do a session on oral health for a while, so this was very exciting.